Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. This past week, the American Association of Endodontists released a white paper stating the AAE's position on vital pulp therapy. As with most position papers, it's heavily referenced with nearly 100 references. While it only talks about permanent teeth and not primary teeth, I thought I'd share a few of the highlights of the paper. First, quoting from the paper, "For years, the focus of vital pulp therapy was on the preservation of the radicular pulp and immature adult teeth, so as to assure completion of root formation. Today, the focus of vital pulp tissue treatment is broader. Practitioners may have treatment options to consider other than pulpectomy or root canal therapy in mature teeth, including teeth previously thought to have irreversibly inflamed pulps." End of quote. Now, the paper is divided into 5 fairly short sections. These sections are diagnostic considerations for vital pulp therapy, caries management, the use of sodium hypochlorite, the use of contemporary materials in vital pulp therapy such as calcium silicate cements like MTA, and the immediate placement of permanent restorations. Here are a few of the points made in the paper. First, while vital pulp therapy used to be considered only in cases of reversible pulpitis, it now can be considered in pulps with irreversible pulpitis. And in fact, the paper challenges the actual term irreversible pulpitis, suggesting instead that maybe pulpitis be better described as initial, mild, moderate, and severe. The paper speaks of the value of surgical microscopes to directly observe the pulp tissue for determining the suitability of vital pulp therapy. The paper also states that complete caries removal is essential to eliminate infected tissues when pulpal exposures occur. Now, as a side note, this is obviously different from indirect pulp capping, where caries is routinely sealed off without being completely removed, but there's no pulp exposure when an indirect pulp cap is utilized. The value of sodium hypochlorite is discussed as an antibacterial solution that provides hemostasis, disinfection of the dentin-pulpal interface, biofilm removal, chemical removal of the blood clot and fibrin, and clearance of dentinal chips, along with the damaged cells at the exposure site. Sodium hypochlorite appears to be the current optimal irrigant for vital pulp therapy procedures. The use of MTA and other calcium silicate cements is advocated for vital pulp therapy, with success rates of 85 to 100% after 1 to 2 years in both symptomatic and asymptomatic permanent teeth. Success rates of MTA and other calcium silicate cements were significantly greater than calcium hydroxide and glass ionomer pulp capping. Finally, the AAE paper recommends the immediate restoration of the tooth following vital pulp therapy. Some of the advantages include the prevention of microleakage, the protection of the capping biomaterial layer, and reduction of postoperative sensitivity. Additionally, teeth that are restored immediately have a higher rate of successful outcomes than those whose restorations are delayed significantly. I'd encourage you to take a look at this position paper. While it's primarily for endodontists, it's also informative to general dentists and pediatric dentists. The paper can be accessed online if you'd like to take a look. Well, thanks for listening, and I'll see you next week.